All right, thank you all for joining us today for this Learning Network webinar on dramatic shift in provider support of breast chest feeding after 2023 U.S. HIV guideline updates, the WELL Project Survey Report. This webinar is being presented by Krista Martell and Sierra Coben, who I'd like to take a moment to introduce. Krista Martell is the Executive Director of the WELL Project, a nonprofit organization founded in 2002, whose mission is to change the course of the HIV/AIDS pandemic through a unique and comprehensive focus on women and girls. Since joining the organization in 2009, Krista has witnessed the profound impact that access to information and an online community of support can have on the lives of women living with HIV, and is working to further expand the organization's reach and network access across the globe. She is also committed to building leadership to ensure women living with HIV are represented at every level of the decision-making process that affects their lives. Krista began working in HIV education in 1995, shortly after her sister was diagnosed with AIDS. Sierra C.C. Coben is an international maternal and family wellness expert dedicated to advancing the right to bodily autonomy for women living with HIV and their families as they navigate the lives they envision for themselves. As a woman living with HIV who has birthed 2 children and breastfed 1, who are HIV negative while living in the United States, Cece has become a respected and highly sought after advocate, speaker, expert, and facilitator in the HIV community and beyond. I'd like to thank both guests for joining us and presenting today. I'll let you know that we are recording the presentation. A link will be uploaded to the City Match web YouTube page following the event. If you have questions, feel free to add them to the chat or ask them out loud when the presenters allow. I am just going to add a link to the evaluation into the chat now in case you have to leave early, but we'll do that again at the end. But with that, I want to turn it over to Krista and Cece.
So hello, good morning, everyone. Afternoon now, where I am. So happy to be here with you today. Thank you for that great introduction. So once again, I am Sierra C.C. Coven. My role now at the WELL Project is Senior Manager of Community Programming, and I'm here with Krista Martell today to present our survey report, the dramatic shift in provider supported breast chest feeding after the 2023 U.S. HIV guideline updates. Krista, you can just add something about yourself.
Hi all, yes, thank you for the introduction and for having us here today. Again, my name is Krista Martell. My pronouns are she, her, and I'm the Executive Director of the WELL Project. And yes, just really excited to be sharing our experience around infant feeding and HIV, as well as some data from the survey report we did earlier this year. And I'm coming to you from Brooklyn, New York. All right, I guess next slide. That's us. So as Kelly mentioned, we're a nonprofit organization, and our mission is to change the course of the HIV/AIDS pandemic through a unique and comprehensive focus on women and girls across the gender spectrum. And we leverage technology to improve the health outcomes and increase quality of life for women and girls living with HIV. Our 5 areas of focus are education and information, community support, advocacy and leadership, development, collaborative engagement, as well as women-focused HIV research. And our website is there. We'll drop some other links into the chat. Next slide. So just a quick kind of overview of how we started working around breast and chest feeding is we have a program called the Women's Research Initiative on HIV and AIDS, also known as the WRI, which convenes annually and focuses on a different theme each year. The one we did in 2018 was focused on U equals U, and contextualizing it with specifically for women. And during that meeting, it became clear that there was a lot of confusion around if U equals U applied to breast and chest feeding, and also how the guidelines, there were, obviously varying guidelines, both, between the US and international guidelines. There was also some even what was being said in the infant feeding guidelines for the DHHS were different from what we'd come up if you were searching for this under like CDC web pages. And we realized the impact of kind of the misinformation and confusion around breast and chest feeding and HIV needed to be addressed. So we started developing fact sheets, webinars, conference presentations on breastfeeding, breast and chest feeding and HIV to start raising awareness and advance advocacy. So, and the goal with that was not to say, oh, everyone should go out and breastfeed, because especially here in the US, when the guidelines were not really, while they were somewhat supportive, they weren't completely clear to a lot of people, because there was also the aspect, which is still happening today, unfortunately, excuse me, around criminalization of women who chose or chooses to breastfeed. And so we wanted to just work on the advocacy part to make sure that if a woman chooses to, that she would receive the support from her providers and other family members and support. So that's kind of where we got started. And then we presented a poster around this topic at the IAPAC annual conference, Adherence 2019. We also did a presentation at USCHA in 2019 and just kind of started raising awareness about this. And then in 2020, we decided to convene kind of a mini WRI where we had a multidisciplinary and multi-sectoral group of experts, including a diverse group of women living with HIV, to come together and just discuss this and try and figure out next steps. And that we did that in conjunction with ICW North America. And that resulted in the expert consensus statement on breastfeeding and HIV in the US and Canada, which had a series of recommendations, including better education for community and providers, advancing research, as well as policy change. Next slide. Cece, I think you're up.
This is I love the logo. It just like jumps out at me, but I'm biased. So yes, this is, I guess, around the time that I came along. I started at the Well Project as a blogger back in like 2019, and Biba was like in its conception early 2021. And by December 2021, we got funded and we were able to launch BIBA, which is Building Equity, Ethics, and Education on Breastfeeding and HIV. So, you know, in the midst of all of these things that we have going on, all of these conversations, discussions, convenings, it was a beautiful thing that had begun happening. Like you could actually like physically see the advocacy in how many different types of advocacy was needed for us to get to this point. And so through BIBA, this 3-year multi-tier project, we were hoping to increase knowledge and expand the access to information around breast and chest feeding and HIV. We did this through creating educational resources, which we'll talk about and see some later. Or how to access those. We worked on leadership development and collaborative efforts with our partners and important stakeholders from the community. Next slide. So why this was so important was like the infant feeding guidelines, as Krista just mentioned, they weren't really clear and not really like all together. I've heard stories of women going to the provider and the provider is Googling, you know, when the question of breastfeeding and HIV comes up. And if the first thing that they saw in their Google search was that you are not to breastfeed, that is the advice that the parents were being given. So, you know, before 2023 in the United States, we were to say to prevent HIV transmission, it is recommended that mothers living with HIV not breastfeed their infants. Although there was some guidance, you know, that if a parent did want to breastfeed or chest feed, that this is what you should do. Many people were not reading past that point in the guidelines. The Department of Health and Human Services perinatal HIV guidelines have evolved over time to like support counseling and harm reduction, that type of approach for people living with HIV who choose to breastfeed despite intensive counseling. As a woman living with HIV, you know, you leave your care in so many other people's hands, and seeing that this is the language that was being used to guide, it was disheartening, and it was a real hard obstacle and barrier to make it past, to get to the care that you wanted. Next slide. So in 2022, the B was in full effect by now. The Well Project was engaged by the Infant Feeding Guideline Committee to provide input. This was such a beautiful experience. It was very much so needed. I'm sure that that language would look a lot different if community voices did not have a chance to provide input. And the Well Project team, you know, folks that have been very engaged in the work with women specifically over the past 2 decades. I can't imagine what they would have looked like without them. So that time was so special. And then in January of 2023, like it actually happened. It happened January 31st. This is when the guidelines were updated. And that day was a day that we had all been waiting on for so long, because we knew that it was coming. We knew that many changes were in there that were going to be helpful and impactful for parents living with HIV and those that care for us. And then it finally happened. Then at that same time, the CDC, they changed to match what they were saying to the Department of Health and Human Services, which was like, yes, this is what we needed. And you would love to think that the work is over then, because now the guidelines have been updated, but no, far from that. It still took another year and some change for the American Academy of Pediatrics, AAP, to update their infant feeding guidelines. And you can just imagine what kind of tension that could create for providers who are caring for the parents, and then the providers that are caring for the infants themselves. One guideline is saying this and one guideline is saying that, and we have definitely seen in a community where these guidelines are like, they're vital for folks accessing the care that they desire for themselves. But that did happen, and that was a really huge time as well. In September of this year, the CDC funded what is called the Understanding Parental Lactation and Infant Feeding Decisions Tailored to People with HIV study, or the UPLIFT study. This is big. This is huge. And I, as a woman living with HIV, I have the extreme honor, to sit on the protocol development team for this study, which is huge. And that has been a consistent theme throughout, you know, this whole process, is the importance of involving community voices, community stories, allowing us to tell our own stories in our own ways, and the impact that it can have, not just in our own lives, but, you know, on a larger scale as a whole. Next slide. Back to you, Krista.
Okay, so I'm sure many of you are aware of some of the key updates in the guidelines, but I'll just kind of quickly run through these. So for the first time, there's guidance about, you know, the importance of shared decision making, which previously had recommended against breastfeeding for women and other birthing parents living with HIV. There is much clearer guidance around the actual transmission rates on the data that we have, which is fairly old at this point. I think goes back to 2017 is the most recent data that most people are going off of, and it was outside of the US. So again, what CC is talking about with the uplift, this is the first kind of prospective research here in the US, which is really excellent. So the data we have is that for undetectable status, the transmission rate is less than 1%. There's also detailed information around the potential benefits of breastfeeding, which was not included in previous guidelines. This was a really big one that we really tried to impress the need for this, that there's a kind of call out that caution to not engage Child Protective Services in response to infant feeding inquiries. Sometimes it's not even someone who is actually breast or chest feeding, just even inquiring about it with their providers or at the hospital has prompted threats of criminalization. And so this was a very important one. There was more guidance on how to counsel birthing parents around their infant feeding options. Also details guiding care management to reduce HIV transmission risk if a parent decides to breast or chest feed. It also included equity considerations to address effects of structural racism, poverty, and segregation, which disproportionately impact Black women and other women of color, and guidance for transgender and gender diverse people who desire to breast and chest feed. So it was very comprehensive, and the updates, as you can see, really did take into consideration the needs of the community. Next slide. So under our BIBA programming, we did a baseline study in 2021 just to kind of measure attitudes and knowledge around infant feeding and HIV, and that included feedback from both healthcare providers, women living with HIV, as well as other people who are working in the field, and just to kind of assess their knowledge. And we didn't put out a big report about that, but we definitely learned that while people, and especially providers, said that they supported parent bodily autonomy, the comments that they received and some of the follow-up questions around that didn't necessarily support that. There was a lot of questioning around a woman's being able to make the best choice for themselves and their infants. So after the guidelines were updated, we did, well, actually earlier this year, like, so about a year later, we conducted another survey that was similar to the first one, asked a lot of the same questions, but then we also added a series of questions around the guideline updates. And so we just felt like it was really going to be impactful to measure stakeholder knowledge and attitudes and the impact of the guideline updates. So we had a total of 224, I think, 226, I'm not sure right off the top of my head, of respondents. A little over half were healthcare providers serving people living with HIV, and about a quarter were women living with HIV. I think the other quarter was kind of the group of people that work in HIV, like at an organization and otherwise, but not a healthcare provider or person living with HIV. So, and as I mentioned, it was follow-up to our baseline survey, and we developed this in partnership with our partners at ETR. Next slide. So this was kind of one of the big takeaways. We focused on, this survey report focuses on the data we received from healthcare providers because we felt like it was kind of the most impactful. And this was a self-assessed measure of their support pre and post guidelines, but you can see that 32% said that they were supportive of a woman's choice and to how they were going to feed their baby, were mostly very supportive. And then after the guideline updates, 82% said that they were mostly very supportive. So that was a pretty huge shift in their support of a woman's right to choose on how they infant feed. And you can also see that, there was changes. I think the biggest change was there, but you can also see that 13% said that pre-guideline updates, they were not at all supportive, and 0% post-guideline updates were not at all supportive. CC, next slide.
That's huge. In this survey, we were also able to, identify out of their mouths, or clicks of the buttons, the top 3 ways The provider said that they can support the infant feeding decisions of women and other birthing parents living with HIV, and you see them listed here. Number one being initiate non-judgmental discussions around infant feeding options. Number two, provide evidence-based information on HIV transmission for all infant feeding options. And three, ensure the parent and infant's entire care team, everyone involved is supporting the woman's decision on how to feed her child. Here at the Well Project, we have created materials throughout this programming and other programs that does help initiate those conversations. That some feedback that we've received from another report is that, you know, having these pocket-sized pamphlets to be able to just talk about breast and chest feeding, whether it's handed to them by a patient navigator in the waiting room or by a nurse as they're waiting to see their provider, that these materials are helping to open up those conversations that sometimes they can be hard for all that are involved. But seeing that the providers felt like that was something that they needed some help with, and we're here, we have tools to be able to address that. And as a mom living with HIV, the evidence-based information was really important, and not being withheld that information because a provider wants me to make a certain decision. I want to have all of the information, evidence-based, whether you perceive it as being good or bad, but love to have it so that I can make my decision moving forward. And then at number three, is so important. We've seen this before the guidelines being updated and afterwards. If that parent and infants like care team is not on the same page, any one of those individuals listed and more, the OBGYN, infectious disease, pediatrician, lactation consultants, doulas, midwives, if someone is not on the same page, they can totally sabotage a plan that has been in play, sometimes for many parents, the entire pregnancy. So seeing that these were ways that were identified in this survey were really validating. Next slide. Then the top three obstacles that they listed that they face when considering infant feeding decisions is number one, the lack of culturally responsive educational resources for women living with HIV. Number two, that lack of support from others on the care team. And number three, lack of explicit policies in their institution or organization that support breast and chest feeding. And the first two sort of mimic what we've seen in the previous slide. That number three, I feel like just impacts so much of what the experience of the patient and the provider can be, because those policies, those overarching policies they can impact how a person can be supported within an institution, and recognizing it as a barrier is certainly something to highlight. Next slide. Here's a quote that comes from one of our respondents. It will be crucial for providers to put this decision-making power back in the patient's hands, which means providers must be thoroughly educated on the topic to avoid further stigma and misinformation. Next slide.
I think that's back to me. And I'll just mention, while the funding for BIBA has come to an end, we did receive support from ViV Healthcare back in, like Cece said, back in 2021, which was kind of a little bit, I don't know, risk, but I think they had to kind of take a little bit of a risk to fund that programming, especially since the guidelines is pre-guideline updates. And so that's through their Positive Action for Women grant. And so we're really grateful for that. So some other survey findings that in general, 2/3 of the respondents have heard about the updates. There's a high level of awareness among healthcare providers. compared to non-healthcare providers, which is 74% to 55%. The main source of information about the updates came from respondents' workplace, 68% from healthcare providers and 42% non-healthcare providers. And of those who were aware of the updates, 2/3 were mostly or very familiar with the changes to the guidelines, but also, again, not surprisingly, there was a higher level of familiarity among healthcare providers compared to non-HCPs. Next slide. So some of the next steps is that we presented, well, not me, Cece and Olivia Ford, who is our editorial director, who I believe is on this call, presented a poster at the 2024 National Ryan White Conference on HIV Care and Treatment in August. And the survey results reflect strides made in publicizing the updated guidelines, which are proving to be powerful tools to support shared and informed decision-making. And as you can see, the updates are shifting attitudes and behaviors amongst healthcare providers. So we feel the biggest part here is we need to continue increasing awareness and expand upon this vital information. So while we are seeing people, especially kind of who are tapped into a network like such as the Well Project, are pretty familiar with the updates, we know there are so many providers across the US, especially maybe non-IDs or HIV providers that we really need to kind of keep sharing this information. So just because the updates happened, both, with DHHS and AAP, we feel that it's important, not just for us, but for anyone here and beyond, to keep sharing this information. So that's one of our goals, and we encourage others to do the same. And so we've dropped some links in the chat, and we have tons of resources, and we'll also, at the end of this, give you some information on how to stay connected to the Well Project for any other updates or access to our resources. And I think, is that next slide, I guess? I'm not sure. Okay, this is Cece.
Yes, so there goes the updates on our survey report. And now we want to hear from you. So first, we'd like to open it up for any questions, any comments, if anything to say. Yes, please do feel free to come off of mute. Yes.
Hi, I'm Luntita Deathley with the University of Miami School of Medicine. And first, thank you so much for this wonderful presentation and this comprehensive update, and also of this very good news. I will have to say, so as I said, I'm from Miami, which is in the state of Florida. And so, yeah, there's definitely still a lot of work to be done, as we're in our institution. I think, we're doing pretty well because we actually have an interdisciplinary team. I'm not a medical provider myself. I'm a researcher, more like at the doctoral level. And so we actually have an interdisciplinary team to guide persons with HIV who have decided or even considering breast chest feeding. So, we're doing pretty well in terms of being updated on the guidelines and providing the proper guidance. But, just around us, there's definitely, misconceptions, and people are not aware. And I think particularly on the part of the pediatricians, because of this kind of staggered or delayed recommendations from the Academy of Pediatricians. I think that's the organization, from your slide presentation, Krista. That's definitely where we see a lot more of the hesitation compared to those on the OBGYN side. And I'm wondering what some other people's experiences are in other parts of the country.
Yeah, I don't know if anyone has any experiences of, trying to coordinate, like Cece said, that obstacle amongst the different care team members.
And I live in Philadelphia, and we have two institutions that take care of the babies, and one is not in favor and one is in favor. So if you're a parent who's not sort of plugged and know before you choose that institution that your baby will be going to, the entire plan that you could have had with your team before that point could totally be, it could change for you depending on the institution that you send your children to. So we're seeing it a lot, especially in places where things are done differently, even down the street. Yes, and
Good morning, Sierra and Krista. Thank you so much for this webinar and the important information that you've shared. We were actually just talking about the changes in breastfeeding here in Chicago. And I think initially it was always like one or two different moms kind of coming forward. But I think as providers got more comfortable, it was easier for them to support and encourage moms. And so we're probably seeing twice as many people this year as we did last year. And we kind of expect that to continue, where we're going to, there will always be some people who want to formula feed for whatever reason. But we feel like as long as you are choosing what is best for you and for your situation, for your body, for your life, as long as you can have that honest conversation, it just leads to better outcomes and better support. So I know that we're also looking at one of our providers is on the guidelines committee and looking at changing some of the guidelines instead of just low risk and high risk infants, that we have like a third category to say, how do we decide how and when to treat infants that are being breastfed, and how much medication, and how to really make that decision when that is indicated, so that we feel like we can be the best possible support to the families that we work with. So thank you so much for this work, the work that the Well Project is doing. We try to encourage our clients to log into the Well Project and to see what is there for them so that they can feel supported in their decision making, and not just me and my doctor and my pediatrician are the only ones who kind of know about this decision and can support me in this, that there are definitely other ladies, other moms, parents that you can talk to around this as you're trying to make the best decision for yourself.
thank you. And anyone else have anything to say? If you do, just jump off mute. Just go to the next prompt. So what resources or mechanisms of dissemination is the best way to reach more providers to inform them of the updates? Like what do providers want? What do you think that they want? Would love to hear some thoughts from you all.
I'm not, as I mentioned before, I'm not a provider myself, but certainly as more institutions that they look to. So the journals, the quote unquote green journal and the green journal, the different societies for both obstetrics and gynecology. I think the more that these, kind of like a top-down approach, and when word comes down from these societies into these institutions that medical providers look to for expert guidance and who they trust, for the information. I think that is where, we'll begin to see kind of like more bang for the buck, to say.
Yeah, and we agree. I mean, we did actually have an abstract accepted at the annual ACOG conference a couple of years ago, but it was not a very community-friendly conference, and it was going to be very expensive for Cece and I to go and attend and present. And so we kind of kept trying to see if they had any kind of discounts for community organizations, and we weren't successful. So our abstract still somewhere online, I think, but we weren't able to actually attend that conference. But yeah, I think OBGYNs, like Laura had said in the chat, the lactation consultants, doulas, midwives are all places. And then, even public health professionals, we have been trying to increase our reach there, as well as just family medicine. And so there's definitely just kind of like a nonstop uphill areas of how to get out this information and disseminate it. So if anyone has any contacts with any organizations in those areas that we could kind of connect with, that we're always seeking to bridge more gaps.
And then you like, oh, this group of people, and it's like you can always think of so many different groups of individuals who need the information. During the presentation yesterday, Child Protective Services came up again. They're like, have you ever thought about, reaching out? It's like, yes, we've thought about it, but then the obstacle and barrier that presents itself there is that those agencies are run by the different states. So in order to infiltrate those systems, it would take a lot of like intentional work capacity that we don't have to be able to reach those entities. So it's starting to think on larger scales, like how do we reach the social work students? Do we actually go directly like university level and start bringing awareness at that level for new folks to get out? What do we do about the folks that's already been practicing and doing these things? So yes, I would love all of the innovation and thinking of how we can continue to work to get this awareness out.
So speaking of innovation, so we have both Ashley and Reagan online. So I am the co-chair for the committee, the City Match Committee, which is called something like the Innovation Clearinghouse. And one of the things that we focus on is things related to, scholarship and research and things like that. So perhaps we should have a presentation within the committee, and, perhaps we can work collaboratively together to, I don't know, maybe write an opinion piece that goes into the journal, Obstetrics and Gynecology Journal or the ABOG or something like that.
More than happy to collaborate on that. That would be great if it could get initiated there and bring in some of the Cece and I are both part of the Building Healthy Futures working group for City Match, and Cece and Ann are the co-leads on the community work group. So we've been talking about how we can better kind of cross collaborate, I guess, with the different working groups. So any initiatives that could kind of get started and then brought to the other teams, I'm sure we would all be happy to start kind of thinking of how we can move that forward. And speaking of that, the Building Healthy Futures working group is working on kind of an algorithm of sorts that primarily, I guess the first target is for providers, but kind of and how they can approach the discussion and, the different types of responses based on what the mother or birthing parent has questions around, but just to give them kind of a little bit more of a graphic, maybe like an infographic type view of starting these conversations. We do have, and I don't know, I could share my screen really quickly just to run through, some of the, because one of the things that they said that there's not a lot of you know, culturally responsive community materials, but I just want to show, and it's not even the full spectrum, but just so people have an idea, because I know it's a lot, about what we've done on around breast and chest feeding. This first link goes to even more resources, some of which were started before this is dedicated to the work we've done under BIBA, but we did even more, so that leads to another whole set of resources. But Cece, she did publish in Patient Perspective. We've been trying to put out updates. You know, these are just kind of news and different places that we've been presenting around or in publications. We have, you know, different conversations. We have a program called Leadership Exchange, where we have different community experts have conversations around different topics. So we have a series of those around clinical guidelines, legal considerations, health implications, bioethical. Some of these are pre-updates, so that's also something to keep in mind. We have a discussion group for women. It's a private Facebook group, so people can email biba@thewellproject.org if they want to join a Facebook group where women and other birthing parents are able to kind of connect with each other and chat or ask questions. We also have a HIV and infant feeding listserv that we started that is open to it is a very diverse group of people interested in this topic. And so a lot of times someone will come to it and post a question, and maybe Olivia or Cece can drop in the chat to email Olivia to be added to that listserv. But it's been extremely helpful. If someone has a question about a certain woman's situation, whether she's facing legal aspects or it's a treatment related situation, and people have been very coming together. They also share resources. We have some provider resources, including the survey report. CC presented at the international workshop last year on this topic. So we have recaps from CROI. And then, of course, we have a lot of educational resources for community, including these infographics, which are kind of taken from the printed pamphlets where I dropped a link in earlier that you can order. And then we've worked with a number of partners on different programs. So there's a whole set of resources here. We did a postcard on the guideline updates. So you can see this looks familiar because that's what we pulled for the slide. So there's all sorts of materials, and please always, you know, we encourage you to use them. They're there, they're free. And we have a certain number of them in Spanish as well. So just wanted to go through that so people kind of see the full scope of what's available, at least through the Well Project. And then we have a lot of links to other resources as well.
All right. Well, in the next prompt, we were going to discuss were like, what challenges have you or your colleagues faced in trying to support folks? And while people are thinking of their answers, those resources, I would say once again, have been extremely helpful from the feedback that I have heard and read in communities. So please take a moment to utilize them free of charge. We will get them to you. But challenges. No challenges. Everybody's having a great.
Okay, since no one else is saying anything, one challenge for us in Miami, and I'm sure this would be reflected throughout the country, is especially because we're in a non-Medicaid expansion state, and so babies like gap in insurance coverage, which then limits the follow-up for the babies and sometimes the moms, as they continue, breast chest feeding, for however months, that they decide to continue. So that's a challenge. That's something that we've been, there's only so much that we can do from the perspective of education, advocacy, navigation, but that's the reality of, will there be follow-up available for the baby and the mom in order to continue be, after the first few weeks or so of life, of the baby's life.
Such a great point in knowing that the recommendations from different providers are different. They're still pretty consistent that, baby maybe needs prophylaxis and baby should be getting tested. I know that me and baby gave blood work every month. And I felt like my providers even went the extra mile to make sure that I was able to give blood at the pediatrician. And I don't know what they did behind the scenes to make that happen, but that helped so much for me not to have to go visit another lab and go back to my provider. And I can only imagine what type of barrier that must be if, like, just getting a baby tested after a while is becoming an issue. Laura did put into the chat that as a postpartum nurse, challenges have been lack of institutional policies, including support in breastfeeding and milk expression guidelines, as well as a lack of awareness and knowledge of inpatient lactation consultants. Yes. Yes, yes.
We just had we have a community advisory board that meets quarterly all together, and one of the discussions we were having is around the need for more postpartum support for women, and kind of what types of resources are most needed. So we may be putting together, but I think to some of the points being in the chat too, that's the same is going to be needed around kind of education for providers as well. So, because that is especially something that, and Cece can speak to this personally, but the access to care for the mother seems to drop off quite a bit or at least attention as well.
Oh, I'm sitting in a very salty space of this right now. So it's like fresh at the front of my mind because the diagnosis of diabetes just came. And my baby is 3 years old, and it kind of makes me emotional, like when I think about it and how much work we all have in my own personal experience in all of this. So, baby makes it here negative. We breastfeed babies negative, and all of my care just fell off so much so to where I didn't even know that I needed to have a primary care provider outside of my infectious disease, because as I've been managing my infectious disease for 16 years, it has always been my HIV doctor was always the doctor I went to for everything. If I was sick, because this building had everything inside of it. But the moment that I decided that I wanted to breastfeed, that disrupted all of my care, which needed to, in an emergency, be pieced together so that I could birth this healthy baby. But then afterwards, there was no follow-up. There was no making sure that I was in care. And so who knows if I would have seen a primary care physician, because I was taking care of HIV. I was treating that after baby was here. But what happened to the other parts of me? And if I had been in care, primary care at that, then maybe they would have seen when my A1C was creeping up, and maybe there were things that could have been done in place. But the care for the parent really does seem to dwindle off. And I'll say even for baby, like after HIV test has come back negative, nobody really cares anymore about Zuri. You know, we go to wellness checkups, but nobody really cares. Okay, so the last prompt as we come to the end of this beautiful presentation today. I always love having these discussions. Do you have any positive stories or experiences to share as a result of the guideline updates? Like, are you seeing changes where you are? I love that Anna spoke that they're seeing an increase of parents that are coming in that want to breast or chest feed. Or is there a high note that we can leave on today? I love that.
Definitely in Miami, we're seeing an uptake of willingness, a huge uptake in willingness, and along that continuum, an uptake of actually breast chest feeding. So that's a high note to end on for the South.
You.
I know Ashley was in the comment sharing who Ashley is pregnant now. I'm telling all your business on the internet, but she's pregnant now and just so excited. So I know that she did have an experience where she breastfed with her second child, and she was saying how the pediatrician allowing her to give blood there too made it easier and saving that extra trip, and how she also doesn't have a PCP. Her HIV is doctors who she goes to for everything. So, you know, and this is a lot of times how it happens in community. Oh, you're doing that, maybe I should be doing that too. But sometimes if we could get more information into the community, like maybe you all should be doing this, maybe, you know, some guidance would certainly be helpful. And we keep getting the shameless plug of the evaluation. So that is in the chat. If you could take a moment to complete that. Okay, Laura, I see your comment. More pregnant and birthing people considering breastfeeding early in the pregnancy and bring that to providers rather than sharing the decision. Yes, wholeheartedly agree. If there is nothing more, I think we're done on our end. I'm not sure if you want to add anything, Krista, but thank you all so much for having us today. This has been great.
Yeah, no, I thank you. And yeah, this is just the QR code, which the link was already dropped in the chat as well to the survey report. And the next slide is just other ways to access our platforms. I mean, wellproject.org. I dropped a link to, if you want to subscribe to our newsletter, there's the information on how to join the HIV and infant feeding listserv, which just to give you a heads up, it's not like something that floods your inbox all the time. In fact, we probably should have shared this webinar, which forgot. But it is a good resource if you ever like just want to be connected to others that are interested, and it's both in the US as well as some global partners. And yeah, I think that's really it. But this is helpful because I think, you know, like I said, we've been doing more and more work to do kind of community directed education for providers. And so having this information, while our hands are full with a lot of different projects, having this information always helps us inform kind of what types of funding we're going to be looking for. So we know we still have a lot of community-based education to do, but I think there's a lot of provider-based education to keep doing, as well as, like we said, all these different stakeholders within the lives of a pregnant and birthing person that are needed. But thank you very much for all for being here.
Yeah. Thank you to everyone who attended, and thank you to Krista and Sierra for providing this information. it's forever valuable if you're interested in any of the City Match groups as well. You can reach out to us and we can get you connected to the right team here. I know you all are doing a lot of good work in each one of those work groups. So we look forward to seeing your work as we continue, and I'm sure the conversations will continue.
Thank you very much. Thank you.